Thank you for being here. It's an important day. My name is Luis Valenzuela. I'm from the Healthcare Education Project. It's a labor management initiative of 1199 and the Greater New York Hospital Association. So we're here today because of the looming cuts in Medicaid for nursing homes and the devastating consequences of those cuts. Those cuts are going to be implemented on the 6th of November, and they're retroactive, so it's a double hit. And so that's why we have assembled here a distinguished panel of healthcare workers, legislators, and administration from Parker Jewish. And of course, thank you to Parker Jewish for having us here. So we're going to start off with Assembly Member Phil Ramos.
Thank you. I'm Assemblyman Phil Ramos, Deputy Majority Leader of the State Assembly, and I stand in solidarity with the clients of all the nursing homes throughout New York State, the staff, our union members, and the public who needs these services. The New York State Department of Health is planning a massive cut in Medicaid funding to nursing homes, and I oppose New York State Department's Health $250 million cut to nursing homes that is expected to go into effect November 6, 2019. These cuts will jeopardize the healthcare, jobs, and quality of care in nursing homes. Over 600 nursing homes throughout the state will see a loss of funding when they are already operating in negative margins. The DOH plan would destabilize nursing homes across the state, including many that are already in deep financially challenged situations. And in doing so, they would threaten the access to needed care for thousands of Medicaid beneficiaries across New York State. Our aging population is growing, and we have more residents over the age of 65, 3.2 million. We have more residents that over that age than the entire population of 21 states. That's our situation here in New York. In just 10 years, that number will have grown by over 1 million. Our citizens need, and increasingly will continue to need, quality long-term care options. Rather than cutting payments and services for the population, we should be making investments necessary to meet their needs now and into the future. Our aging population needs to be protected in a time of need. Not only will this affect the residents of nursing homes, but their families as well. Nursing home residents and their families rely on nursing homes to provide comfortable living and healthcare services. Thousands of direct care workers depend on this also for their livelihood. That will provide care, and they would be at risk of losing their jobs if these cuts go into effect. Our seniors are people who have spent their lifetime paying taxes, contributing to society. It would be a disservice for us to balance budgets on the backs of the pioneers of our community, of those who led the way for us to have the life that we have today. We owe a debt of gratitude to them, and we cannot look at this as if it was just a calculator. There are human beings, there are human faces, and there are human families behind this issue. So we have an obligation, and I stand together, and I urge the New York State Department of Health to stop the implementation of these cuts that will be affecting nursing homes and expected to go into effect 2019. Thank you.
And next we have remarks from Suffolk County Legislator Sammy Gonzalez.
Once again, hi. I'm Suffolk County Legislator Sam Gonzalez of the 9th Legislative District. But I'm also Sam Gonzalez, President of IBEW Local 1430. In this year's New York State budget, the Department of Health was asked to look at a formula used to calculate how much medical funding is provided to nursing home facilities. The Case Mix Index, CMI, with an objective of improving the distribution of funding. Yet, instead of achieving this objective, the Department of Health proposed an across-the-board cut of $200 $650 million in Medicaid funding to nursing homes. Ladies and gentlemen, we are in a fight of a lifetime to protect our nursing homes, to protect our union jobs, to protect jobs, period. If this cut goes into effect, over 600 nursing homes around the state will be affected. Tens of thousands of nursing home residents are going to feel the pain. The cut will impact many direct care jobs in nursing homes, and some nursing homes will be at risk of closing. Those closures will result in residents being forced to either relocate to another facility, likely further away from their families, or find some other less ideal alternative. Aging requires complex, often life-saving care. It also requires comfort. As senior citizens are our most vulnerable of citizens. Direct caregivers provide all of this and more, working hard to ensure that nursing home residents are happy, healthy, and above all, cared for. They do this with limited resources. And yet, New York continues to have some of the highest quality facilities in the country. The peace of mind this gives to the families cannot be overlooked either. Knowing an elderly relative is comfortable, that they are happy, and has the access they need to health care they depend on, allows the loved ones to be at ease. Most of us know someone who lives in a nursing home. And we understand the immeasurable value of providing quality care for our aging friends and our aging family. Why does this matter? Already nursing homes across the state are reimbursed nearly 20% less, if not more, for the care they provide. And who's going to suffer? The obvious answer is the nursing home residents. Approximately 75% of New Yorkers in nursing homes rely on this funding. But also those residents' families and the communities these facilities are in. So to all my fellow elected officials that have the power to do something about this, to enforce change, I ask them to please fight and stop this devastating cut. Our mothers, our fathers, our grandmothers, and our grandfathers' lives depend on you doing the right thing. Thank you very much.
And next we have Assembly Member David Wetton.
I have my 1199 purple on. You know, I represent probably about 10 nursing homes in Queens. I start right here on the Nassau border, and I go all the way into Richmond Hill. And very, very diverse communities, very diverse constituencies, but we all have the same reliance on our nursing homes, which are already underfunded on reimbursement, as you heard. They're operating under very tight margins, but they're really providing essential care to our elderly and also not elderly, but those that need nursing care, that need rehabilitation. Parker Jewish Institute is one of the finest institutions in the country. As you heard, this cut will result in about close to a $250 million cut, to our nursing homes. This particular task force that was established really after the budget did not represent nursing homes. And nursing homes are one of the biggest providers of adult care and senior care everywhere. So it was really very short-sighted. I wrote a letter to Commissioner Howard Zucker back on July 17th, complaining about these cuts, asking them to reopen the task force to consider the cuts' effects on our nursing homes. And I'm sure you're not surprised I did not get a response from Commissioner Zucker. So hence, we need to have these type of press conferences, these type of rallies, because who's going to be hurt? The people are going to be hurt. And good union jobs, our constituents who work so hard at relatively low wages, but really are so dedicated, direct care personnel, nurses, so many other medical personnel. So I'm here to say to Governor Cuomo and to Commissioner Zucker, reopen the task force, it's still time, and make changes to these proposed cuts to help out our nursing homes. Thank you. Yes, right. Also wearing his $11.99 purple.
All right, so next we have the honor of inviting Council Member Barry Rodenchik.
You can clap if you like, it's okay. Thank you everybody for being here today, and thank you Parker for hosting us as you always do so magnificently. I'm proud to stand with my brothers and sisters from 1199. I'm one of the few elected officials who actually lives in a union household. My wife is a NYSET member, and I understand how important the union movement is. We're here today to talk about a proposed $250 million cut for nursing homes. And that is an awfully large sum of money. And I want to talk about it from my own personal experience because my father, blessed memory, was a patient here at Parker. And he received outstanding care. He was in kindergarten when my father was here. It's a long time. And I can tell you the experience that my father had and my family had, knowing that my father was well cared for, knowing we could leave. My mother was here every single day. I was here every single day, and my brother and sisters as well, because we wanted to be with our father as he was facing his last days. But the care that he got here, it's personal for me. It was magnificent. There wasn't anything that wasn't done for him that needed to be done. And I wanted to bring that out today because this is not about dollars and cents. This is about—
Although it is.
It is, but it is about human— I can count pretty well, I'm married to a math professor. But it's about human lives. And we understand at times that cuts have to be made, and as legislators, we make those difficult decisions. But this is a time of plenty. This is not a time where money isn't flowing, and we know that. We know that. So I'm here today with my constituent David Wepper and my former colleague Phil Ramos. We got to Albany together. He stayed there a little longer than I did. And Sammy, welcome to Queens. Good to have you here. And I grew up across the street from Electchester, so practically an IBW member. But many of my friends are local 3 members. But I'm here today to ask and to say to Governor Cuomo and to Commissioner Zucker, this is not the place to take the scalpel out. This is a place where we need love and we need care and we need money because people can't work for free. If they could, maybe they would, but they can't. And above all, the patients in this building, there's over 500 people here that you serve. This is one of the largest employers in my district here. We're not really we're a bedroom community here in Eastern Queens. But many of the people that work in this institution also live in my district. And we don't want to see, above all, them get hurt, and certainly the people that they come to work for every single day in the rain, in the snow, in the hot weather, in the cold weather. they need to be here for them to help people that cannot help themselves. So if you gotta make cuts, I understand that there's not an infinite supply of money, but nursing homes should be off limits. Thank you all.
And next we have remarks from a great 1199 healthcare worker, Gita Sega.
Hi everybody, my name is Geeta Sega. I've been working with Parker Jewel for the past 3.5 years. It's been wonderful, but with any cuts, service to Parker as well as care for the residents will be extremely harmful for them. They, they wouldn't get the quality care that they want. So today we're asking that the cuts not happen. Our jobs could be in jeopardy. So it come back down to the elders not getting the quality care that they need. We have over 3 million residents and elders over 65, and next 5 years they might double that. So we really need the support and to avoid the DOH from giving us any cuts. Thank you.
And next we have another 1199 healthcare worker, Jaquel Enoch.
Good afternoon, everyone. My name is Jacquel Pena. I've been an employee of Parker Jewish for over 6.5 years. As a New Yorker, we will need to continue to meet quality long-term care options. Instead of cutting payments and services for this population, we should be making investments necessary to meet their needs today and into the future. The proposed CMI cut will hurt financially fragile nursing homes, endanger quality resident care, and put crucial healthcare jobs at risk. Again, we urge the DOH to immediately stop the proposed cut.
And next we have remarks from a friend in labor, the executive director of the Long Island Federation of Labor, Roger Clayman.
Thank you. I thought we were in Long Island, but I guess we're.
Exactly. We're all on that.
Okay.
The parking lot's in Long Island.
That's right. Usually when we have a gathering, we find out where we are by which police force shows up. But as you know, this is not the typical 1199 rally because usually it's 10 below zero and we're outside. We have a huge crowd and we did that last year. And we found out that when we all stick together, regardless of the weather, we can turn these things around. And that's what we're gonna do, we're gonna turn this around. I wanna thank our friends, Councilman Westman and Ramos and Legislator Gonzalez and.
Gordenchik with a G.
Thank you for your help. We really depend upon good friends to win these fights, and that's why we win them, because we have people like the people who are here with us today who are willing to stand up for what's right. But I mostly want to thank 1199 for taking on this fight, because you're taking it on behalf of the entire working population, really the entire population on Long Island and Queens, New York City. Healthcare is important and vital to every one of us, and you're always there to make certain that it's done correctly. Now, one of the statistics I heard is that most healthcare nursing home workers around the country work with poverty wages. Now, fortunately, that's not exactly true here in New York, but that's only the case for one reason. We've got a good, strong union, 1199, and you have good relationships with ethical and committed nursing home operators like Parker Jewish. And so we have a lot of things going for us in this fight, but a lot of nursing homes are not as well funded as they ought to be, and we have to stand up to that. We have to stand up to this commission that acts undemocratically. We see it in every aspect of the labor movement when groups of people act bureaucratically and without supervision, without guidance, without accepting the advice they've given from people who are actually in the industry, they act in unaccountable ways. And so we have to fight back. And so, you know, what do we say in 1199? When they cut back, we fight back. That's what we intend to do. Just one quick story. I had a friend came up to me at a recent event and said, I just want to tell you a story that I want you to tell to 1199. That my mother lives at home, she's 90 years old, she's self-sufficient, but she has a visiting healthcare professional who's a 1199 member who comes in regularly to see her. And the other day they came in, they found that her blood pressure was off the charts, everything was wrong with her, and they rushed her into the hospital, and she was taken care of before a serious event like a stroke occurred. And that speaks to the commitment that the public sees from 1199 members, all healthcare workers. Now, none of us aspire to be in the nursing home, but it's a fact of life that we're going to be there. Some of us will be there. Some of our relatives will be there. And the institutes that study this thing say that the one factor that really influences how good the care is how well the staff is treated, how well they're compensated, and how qualified they are. All those things are in jeopardy with these cuts. So we're not going to take it in our labor movement, and from our elected folks, we've got support. You have support. We're going to be there. We've beaten these kinds of things before. I'm pretty sure we're going to beat it again. But the public is with us because they know what you do and how important you are. We have elected people all across Long Island and New York City. We're willing to stand up for you. So you can count on our Long Island labor movement to be behind you every step of the way. Thank you.